On behalf of the medical team at the Hair Restoration Institute, I want to thank you for trusting us with your hair transplant. It has been a pleasure serving you, and we look forward to seeing your amazing result in the months ahead. In this video, we will discuss the post-operative instructions to ensure that you heal quickly and have the best possible result. Upon discharge, you'll be provided with a goodie basket that will contain the following items: 1 headband, saline spray, absorbent medical pads, and a bottle of our DHT blocking biotherapy shampoo. If you opted in to receive our hair loss control kit, you'll also receive a scalp cleanser, additional DHT blocking shampoo, a vitamin-rich conditioning treatment, a daily topical serum to thicken your hair, and a 2-a-day vitamin to promote healthy hair growth. If you have not yet opted to receive this package and would like to, please speak with one of the staff members before leaving the clinic today. Let's begin with the saline solution. Once you arrive home, you should use the saline spray bottle to moisten the recipient area every half hour while awake for the first 3 days. We recommend draping a towel over your shoulders as you fully soak the area. Once the saline solution has been used up, you may use ordinary tap water or tap water with added salt. It's important to keep your new hair hydrated as your transplant heals. Spraying your grafts also limits the formation of noticeable scabs. Next, wear the provided headband as much as possible for the first 3 days. This will reduce your swelling. You'll want to briefly take it off once a day to let your scalp breathe. For the same reason, when you go to bed tonight, you'll want to sleep at a 45 to 90 degree incline. Use a couple of extra pillows to prop up your head, preferably with old cases or covered in a towel. Airline pillows work great as well. Continue sleeping upright for 3 days total. If you forget to wear your headband or sleep upright, the saline solution used during the procedure may drain through your face, giving you a puffy appearance. If this happens, don't worry. Simply massage your face from the nose to the ears to help the fluid drain. The swelling will not impact your result, but it may take 3 days to resolve. Oozing and light bleeding is normal early in your recovery. If significant bleeding occurs, take the provided bandages and apply firm pressure to the site for 5 minutes. You've been provided with medication. Keep taking your antibiotics as directed until you run out of medicine. Take the pain medication only as needed. If you are a little sore, you can take Tylenol. Now for what not to do. Please do not touch your grafts for the first 3 days. Do not apply ice to the graft area. Do not use hair products or a hair dryer. Please refrain from alcohol use for the first 48 hours. Refrain from aspirin products for 72 hours. And refrain from tobacco products for 10 days. Please take a break from working out or lifting objects heavier than 15 pounds for the next 2 weeks. Please also limit your sun exposure for 2 weeks. Finally, when you get home, please do not shower your hair. The water pressure of many shower heads can harm the transplanted grafts. Instead, for the first 2 days after surgery, only shower from the neck down. Starting on the 3rd day after your surgery, you may mix gentle shampoo in a mug with shower water and pour this mixture over your head. Rinse in the same manner with plain tap water. You can air dry your hair or use a gentle towel to pat your hair dry. Be gentle and do not rub your hair with the towel. Continue washing your hair daily until all of your scabs are removed. Please do not pick your scabs. You may once again wash your hair under the shower starting 6 days post-transplant. A copy of the full post-operative instructions will be provided in your goodie bag. If you have any questions, please do not hesitate to contact the Hair Restoration Institute at 612-588-HAIR. If you have a question after hours, you will also be provided with the direct phone number to your attending physician. Now for some frequently asked questions. When can I cut my hair? We recommend waiting 30 days before getting your next haircut. When can I dye my hair? You must wait 6 weeks before you can dye your hair. It is recommended that you color with semi-permanent dye so as to not damage your grafts. When can I wear hats? You can wear a loose-fitting baseball cap starting 2 days after your procedure. Please make sure that the hat sits across your forehead and avoids contact with the recipient area. When will the scabs fall out? Scabs should fall out in 7 to 14 days. If they do not fall out by day 14, use more frequent showers, petroleum jelly, bacitracin, and warm compresses to help the scabs fall off. When will my sutures come out? If you had an FUE procedure, you do not have any sutures. This is only applicable to strip or FUT hair transplants. The team should schedule your suture removal for between 10 and 16 days post-transplant. Please check with the front desk before you leave to see when yours will be scheduled. If you're out of town, you can have your sutures removed at any urgent care facility. How long will it take before I can expect to see my full result? Hair transplants take about 9 to 12 months for the full result to be achieved. Hair transplants take patience, but it is a natural looking and permanent result. What happens if I lose hair? It is completely natural for the transplanted hair shafts to fall out a few weeks after your procedure. This is totally fine, and your hair follicles, which are planted into the skin, are safe. A new shaft of hair will grow over the coming months and will become your permanent hair. What can I do to improve my result? Every hair transplant performed at the Hair Restoration Institute comes with 6 complimentary in-clinic laser treatments. We recommend using these treatments over the next 2 to 3 weeks to restore blood flow to your transplanted grafts. You can schedule these appointments at the front desk. You can also consider adding in additional laser therapy treatments by signing up for one of our multi-month laser packages. Second, you can consider platelet-rich plasma, or PRP, therapy treatments. With PRP, we draw a small vial of blood and spin it in a centrifuge to derive your body's own growth factors. Growth factors, GFs, are protein molecules capable of stimulating cell proliferation, wound healing, and growth. We then re-inject these growth factors into your scalp in a series of treatments to promote healing and thickening of your hair. Finally, we recommend use of either finasteride or HRI's own natural hair vitamin to block DHT, the hormone most responsible for genetic hair loss. If you'd like to sign up for any of these additional treatments, please speak with one of the staff. Thank you again for trusting your procedure to HRI. We look forward to your hair journey ahead. Remember, you can't spell hair without HRI. Finally, we hope that we have provided you with exemplary service and have made your experience with us as comfortable as possible. If so, we would greatly appreciate it if you would leave us a review using the QR code in the bottom of your screen.